Hi, I'm Paul Jhun, and for today's Hippo Short, we're going to talk about the clinical examination of the wrist in the setting of acute traumatic wrist pain. Now take a look at this classic visual stimulus X-ray. This is a young adult who fell on an outstretched hand and now presents with acute pain of the wrist and swelling. Do you see the abnormality? That's right, when you follow the carpal bones, you'll see this coracal disruption that suggests an acute scaphoid fracture. Now in the setting of a clinically suspected acute scaphoid fracture with a confirmatory X-ray, the management's pretty straightforward. Thumb spike a wrist splint, refer to orthopedic surgeon. But in the setting of a normal X-ray, how do you get to that clinical suspicion of acute scaphoid fracture? Many clinicians would say snuffbox tenderness. That's correct. But did you know that you can evaluate more than just the waist of the scaphoid bone, but also the distal and proximal poles of the scaphoid bone? Let's start off by reviewing the snuffbox anatomy. You want to slightly ulnarly deviate your wrist, slightly volar flex it while extending the thumb, and you'll notice the EPL and EPB accentuating a triangle. At the base of that triangle is the waist of the scaphoid bone. Now flip your hand around. You'll notice the distal crease of the wrist. At the base of the thenar eminence, you'll notice a bony prominence that's more prominent when you ulnarly and radially deviate your hand. That is the distal pole of the scaphoid bone. Flip your hand around again, and you'll see between the second and third metacarpals, the distal radius, there's another bony prominence. That's called Lister's tubercle. Just distal to that is the proximal pole of the scaphoid bone. Lister's tubercle is also another important anatomic landmark for the dorsal approach to wrist arthrocentesis. Just distal to the Lister's tubercle, shifted over between the third and fourth extensor tendon compartments, while you're slightly volar flexing the wrist, is the insertion point of your needle. Now there are other clinical examinations such as resisted supination or axial compression of the thumb to elicit scaphoid pain, but now you know a few more clinical tricks to evaluate for acute scaphoid fracture. That wraps it up for this Hippo Short. My name is Paul Jhun. If you want more information on this topic, head on over to hippoeducation.com. I'll see you next time.